Hey, welcome everyone. Today we are going to discuss seborrheic keratosis, an important clinical lesion and a high topic. What is seborrheic keratosis? It is a benign epidermal tumor, and that is very commonly seen in middle-aged or older individual. Rarely seen in younger individual. Middle-aged onwards, it starts increasing in incidence. The most common site is trunk, and extremities, head, and neck also may be the sites for seborrheic keratosis. So how does it present? It presents as round, flat, coin-like lesions, generally waxy in consistency, and the diameter of the lesion varies from small millimeter to few centimeters, and most of them they have a pore, central pore is there. And so how does it clinically present it? There is a sudden appearance of multiple seborrheic lesions that is commonly associated, and that could be an important sign of internal malignancies, visceral malignancies, commonly gastric adenocarcinoma. So gastric adenocarcinoma patients suddenly may present as multiple seborrheic keratotic lesions, waxy skin lesions. So this is known as leser-trelat sign. This is a very important sign that is being repeatedly asked. So hyperkeratosis occurs at the surface, and morphologically we see multiple deeper keratin cysts, and these are known as horn cyst, invagination cyst. So these are cysts filled with keratin material. So as you can see over the pic here, this is the waxy lesion, and you can see the multiple brownish waxy lesions are seen, and microscopically we can see the horn cyst, invagination cyst, multiple cyst that is filled with keratin material is being seen over here. And treatment, it is generally not indicated unless and until for cosmetic or patient preference. Otherwise it is treatment may not be indicated. Cryotherapy, superficial curettage, and excision is being tried with success, and topical hydrogen peroxide solution may also be tried. Thank you for the patient hearing. Thank you for watching the video. Please subscribe to the channel, hit the bell icon, and follow in our different groups. And please stay tuned for the next video. See you in the next video. Thank you.